Baptist Memorial Hospital making preparations in case the coronavirus outbreak becomes severe. The hospital is the only one in our region to offer so-called ECMO machines for adults. Local 24 News reporter Brittany Moncrief is live to explain what are these ECMO machines and how do they work. Brittany?
Well, Richard, ECMO stands for Extracorporeal membrane oxygenation. It's typically used for patients going through heart surgery or even those with more serious cases of the flu. Well, now Baptist Memorial is rolling it out and getting it ready just in case we have a COVID-19 patient who needs it. It's the absolute last resort.
When everything else has failed, that is the last thing that we can offer.
Dr. John Craig of Baptist said that's when they turn to the ECMO machine.
During heart surgery, we stop the heart and we stop the lungs, yet the patient survives, and that's because of this machine.
So let's say if there is a severe case of COVID-19 and a ventilator isn't doing the job to help pump oxygen.
And so with an ECMO machine, it takes blood out of the body, goes to a machine where there's a pump, so it takes the place of the heart.
Then there's an artificial lung component, getting oxygen to the blood and pumping carbon dioxide out.
There have been several that have survived ECMO, so we do believe it's very beneficial at this time for people when there's nothing else to offer. Fortunately, most cases of coronavirus are mild, and many patients can be managed at home. There's a small group of that population, probably about 10% of these people, will end up needing critical care support.
And that possible 10% of people are mostly those of the more vulnerable populations, such as the elderly population or those with pre-existing conditions. Now, coming up later tonight, we'll answer the questions as to, do we have enough of these machines and how many do we have available? Live outside Baptist Memorial Hospital, Brittany Moncrief, Local 24 News.